Turn your head to the left again. Okay, that's clear. Turn your head to the right. That's clear as well. Look straight down, please. Okay, now we're going to get into the lower back, into the sacrum. All right, so just let me know if you feel any tenderness on the inside of the leg here.
No, nothing.
Nothing? Okay. You feel anything here? Any tenderness in that point right there?
No.
Okay. And what about there? You feel anything?
No.
No? Okay. How about here in this area?
Just up a couple of bits, yeah. Just,
In this area right in here, you feel a little
down,
tenderness,
yeah.
right? Okay.
Because I have been waking up in the morning with just a twinge here as well.
Yeah, when your sacrum's out of alignment, there's certain points that'll fire up and you'll feel some tenderness there. And it's just a confirmation of where the sacrum's going. Lower this leg. Let's recheck. Okay, so we're almost there. You're less than a millimeter off right now. There's something right in here. I'm just going to lower your belt a bit.
Okay.
Yeah. There. Okay, take a deep breath in and breathe out. Good. So a little bit stiff in the mid-back today. And that was the one. Okay, so last test. Without bending this knee, I want you to lift this leg straight up from the hip as high as you can. Perfect. Okay, let it down. And let's do this side now. Okay. All right, let it down. Do you feel like one side was more difficult to raise than the other, or one of the legs felt heavier than the other?
Yeah, the left leg felt heavier, but as I raised left leg, the inside there, on the muscles, you could feel that one, as opposed to not feeling it on the other side.
All right, let's try one more time and let me know if one side feels a little bit heavier or more difficult to lift, yeah? So let's start here on this side. Okay, let it down. And now this side. Okay, and let it down. All right, what do you think now?
It just feels heavy. This side feels heavier here.
Okay, perfect. That's what I'm looking for. Okay. All right, so what's happened is your sacrum has shifted into this joint and it's not allowing you to lift the leg up as high. So we're going to rotate it back into its place. All right. Good. 2 more times.
Okay.
All right, lower this leg, please. Okay, so go ahead and lift this leg. All right, and let it down. How's that feel? Feel lighter now?
A lot easier, a lot easier, yes, I like it.
All right, go ahead and lay face up. Your mid-back is pretty tight today. This can affect your digestion. Any acid reflux or anything like that going on right now?
No, but for the past week, I've felt like I've had a top of the stomach, as if I've had a bloating just in this part here, Jake.
Yeah, okay. And that could be coming from this area because this area is quite locked up today. All right, take a deep breath in and breathe out. There we go, much better. Okay, good as new, Dave.
Thank you very much.
Yeah, my pleasure.
That's why we come.
Yeah.